medical, scientific, professional, academic. Welcome to Midpresso Podcast.
Metabolism and function of iodine in the thyroid gland. Iodine is the primary element for the synthesis of thyroid hormones, THs, in the human body. Both iodine deficiency and excess can trigger various pathological conditions. From conception to adulthood, inadequate iodine intake can lead to functional impairments and developmental anomalies in various organs, including the brain. On the other hand, iodine excess is also undesirable as it can cause thyroid gland dysfunction and diseases such as hypothyroidism, hyperthyroidism, goiter, and autoimmune conditions. The authors of the article The Iodine Rush provide data from a comprehensive analysis published before 2022 regarding the role of iodine and the risk of excessive or insufficient iodination. The primary role of iodine pertains to the physiology of the thyroid gland, the synthesis of thyroid hormones and the modulation of thyroid gland function. Additionally, recent research has revealed the antioxidant, antimicrobial, and anti-tumor properties of this element. During the first 12 weeks of pregnancy, the fetus is entirely dependent on the mother's THs. In later stages, the fetus begins to synthesize independently T4, thyroxine, T3, triiodothyronine. The production of T3 and T4 in its turn is regulated by TRH, thyrotrophin-releasing hormone, produced in the hypothalamus. TSH, thyroid-stimulating hormone, produced by the anterior pituitary gland. TRH and TSH play a significant role in fetal development, contributing to the development of the neural network of the central nervous system and somatic development. They are involved in the mitochondrial respiratory chain, stimulate protein synthesis, and regulate carbohydrate and lipid metabolism. Iodine metabolism is primarily regulated by TRH and TSH, as well as the iodine concentration itself. Iodine deficiency stimulates TSH production, leading to additional iodine uptake, while iodine excess inhibits the activity of the thyroperoxidase enzyme, reducing TH synthesis. Iodine sources. There is significant variability in the iodine content and bioavailability in soils and, consequently, in products from different geographical regions. Most products contain a small amount of natural iodine and are not significant in the diet. It is worth noting that iodine content is higher in marine plants than in terrestrial ones. The main sources of iodine are salt, seafood, fish, seaweed. Salt is a preferred means of enriching the body with iodine due to its iodate or potassium iodide content. The World Health Organization recommends the following iodine addition calculations to salt: 14 mg per kilogram for populations with high iodine consumption, 65 mg per kilogram for populations with low iodine consumption. The level of iodine in drinking water depends on the geographical region, proximity to the sea, groundwater levels, and agricultural runoff. Typically, the iodine level in drinking water ranges from 1 to 10 g/L. Desalinated water can lead to a complete loss of iodine. The iodine content in plant-based foods is influenced by the proximity of the cultivation zone to seawater, the amount of iodine in the soil and irrigation water, and iodine-containing fertilizers. Overall, vegetables and fruits are a poor source of iodine. Eggs and dairy products are the primary sources of iodine. However, the iodine level is also influenced by the feed additives used in agriculture. Additionally, the iodine concentration in milk depends on the season. It is higher in winter due to reduced milk production during that season. In dietary supplements, iodine is present in the form of potassium iodide and sodium iodide. Typically, the amount of iodine in vitamins and mineral supplements is 150 g. However, international standards vary in different regions and often exceed the maximum permissible level of consumption. It should be noted that many diets lead to a reduction in the necessary iodine level. These diets include vegetarian, vegan, low-salt, and lactose-intolerant diets. Iodine recommended intake. Most food products have low iodine content and do not provide adequate intake. Population iodine sufficiency is mainly achieved through salt iodization. In 2021, mandatory salt iodization was implemented in 124 countries, and voluntary iodization was allowed in 21 countries. As a result of this strategy, 88% of the global population is covered by this program. The following biomarkers are used to monitor iodine status: urinary iodine concentration, thyroglobulin concentration in blood, and goiter rate. In 2006, the Institute of Medicine developed recommended dietary allowance for iodine consumption for all age groups, 0 to 6 months, 100 g/day. 7 to 12 months, 130 g/day. 1 to 5 years, 90 g/day. 5 to 12 years, 120 g/day. And 12 years and above, 150 g/day. It is proven that iodized salt is an effective way to prevent iodine deficiency in all population groups. However, cases of iodine excess in the body should not be overlooked. Excessive iodine can result from excessive consumption of iodized salt, drinking water, animal milk, seaweed, and food supplements. This is why maximum recommended iodine doses have been defined. Iodine plays a key role in the physiology of the thyroid gland, being the main component of thyroid hormones. Both iodine deficiency and excessive iodine consumption can cause thyroid diseases and related complications, including growth retardation, neurological and intellectual developmental disorders. Iodine deficiency and thyroid diseases. Up to the 12th week of pregnancy, the fetus is entirely dependent on the mother's thyroid hormone levels. If the mother's diet during pregnancy does not provide adequate iodine, it can lead to disruptions in the fetal thyroid gland function, affecting the development of the fetal neural network and ultimately resulting in various degrees of mental retardation. This condition is called cretinism and is accompanied by other somatic and neurological disorders such as growth retardation and signs of hypothyroidism. Two forms of cretinism are distinguished: myxodematous and neurological. Neurological cretinism is associated with maternal hypothyroidism in early pregnancy, followed by adequate iodine intake in the newborn, manifesting as intellectual disability, deaf muteness, gait changes, spasticity, and euthyroidism. Myxodematous cretinism, on the other hand, is caused by iodine deficiency in the mother in the later stages of pregnancy, resulting in intellectual disability, short stature, and hypothyroidism. Severe iodine deficiency in the mother leads to an increase in stillbirths, spontaneous abortions, fetal developmental anomalies, and neonatal mortality. These complications can be reduced by 50% with iodine supplementation before or during pregnancy. Children with mild iodine deficiency experience impaired executive functions, lower intelligence scores, impaired reading ability, suppression of cognitive skills, and reduced language skills. Reduced iodine consumption in childhood leads to decreased production of thyroid hormones and, consequently, an increase in thyroid-stimulating hormone, TSH, production by the pituitary gland. TSH, in turn, leads to an enlargement of the thyroid gland caused by cell hyperplasia. This tissue hyperplasia of the thyroid gland is called goiter and manifests in two forms: diffuse goiter and nodular goiter. Individuals with iodine deficiency and a consumption below 50 g per day typically have normal or reduced levels of T3, decreased levels of T4, elevated levels of TSH. The symptoms of iodine-deficient hypothyroidism vary widely depending on the age of the affected individual. For example, in newborns with hypothyroidism in the first weeks of life, the following symptoms are observed: lethargy, difficulty in sucking, protruding eyes, macroglossia, prolonged jaundice, abdominal distension, umbilical hernia, thickening of skin folds, psychomotor insufficiency, and constipation.